My name is Brittany McVicker, and today we're going to be talking about the effects of exercise on depression. So, depression is a prevalent problem in today's society, and the most common fix is medication. Medication can be expensive or take a long time to take effect or to see an improvement in the levels of depression. So what if there was an alternative method for treating depression, such as exercise? Could it be equally as effective, as well as cutting the costs that it would take to treat this disease? So the purpose of Article 1, which was by Buthmel et al., was to look and compare how effective home-based aerobic exercise, supervised exercise such as in a clinic, and antidepressant medication was in comparison to a control group. This article is important because in my previous studies that I looked at, they mostly focus on only comparing one form of exercise to a treatment rather than looking at group-based exercise versus at-home exercise versus just medication. So the independent variables were the forms of treatment previously mentioned, as well as medication. And the dependent variable was the level of depression, which was measured using an HAM-D scale, among other scales like the Beck Depression Inventory. A total of 202 adults were recruited, with 153 of them being female and 49 of them being male. And they were recruited from a teaching hospital. So they were all screened for other medical issues that might arise, and as well as given an exercise fitness test, and then they were randomly assigned to the groups. So, after they were assigned, they were all given envelopes which listed what type of exercise that they were doing, or if they were just taking medication, and the placebo group also was told that they were just taking medication. And then, along with their group assignment in this envelope, it also had for the exercise group what type of exercise that they were doing, how long it was going to take, which was also the same type of exercise that was being done in the clinic. And the people who were given medication, they were told to just take their medication as prescribed. And this study was carried out for 16 weeks. So the results showed that antidepressants were the most effective form of treating depression, but also when you look at the supervised exercise, you can see that they're very comparable, with 45% recovering compared to 47% recovering with antidepressants. And not to mention that the home-based exercise still saw a greater improvement of recovery, or at least seeing effect of this exercise in comparison to the placebo group, which only 31% saw an effect or slight changes in their level of depression. So this shows that it is possible that exercise could be a good alternative to treating depression other than just medication. So Article 2, which was by Mocha-Piera et al., was to determine if exercise would be a means for treating treatment-resistant depression. So as it sounds, this is people who have depression and they might have either done medication, therapy, or any other form of treatment and still not seeing any improvements. And for this study specifically, that they were looking for people who were resistant to treatment for 9 to 15 months. So the independent variable was the addition of exercise to their normal treatment plan, or in comparing it to their normal treatment plan. And the dependent variable was the level of depression. So this study had 150 participants that were all taking medication and attending therapy. And so they were placed into two groups, where one group had exercise, therapy, and medication, and the other group had their normal routine of medication and therapy. So this group that had exercise was prescribed exercise for 30 to 45 minutes per day, 5 days a week, for the 12 weeks that the study lasted. And the results showed that with exercise, there was a 21% response or increase in depressive symptoms, reduction in depressive symptoms, meaning that they saw an improvement. And comparing it to the control group, again, there was no change or improvements for this control group. And this article is significant because even in more depressive or severe depressive symptoms, we can still see a benefit of exercise. Moving on to Article 3, the purpose for Article 3, written by Helgator, Helgen, Eblon, and Forsell, was to determine what was the most effective intensity or mode of exercise. The independent variables for the study was the type of exercise and the intensity, which they had classified as light, moderate, and vigorous, and the dependent variable was the level of depressive symptoms. The only inclusion criteria for the study was to be between the ages of 18 and 67, and they had to score higher on the depressive scale that they were using to indicate that they had moderate depression. So they were divided into the different groups, and the control group just continued to meet with the therapist and were taking their medication, while the exercise group were asked to join a class that met 3 times a week for about an hour, and this lasted for 12 weeks. So the types of classes were light was usually doing yoga, moderate was aerobic exercise, and vigorous was aerobic conditioning. So the results showed that there was no difference in between the types of exercise intensities or mode of exercise, but they all showed that there was still an improvement in the level of depressive symptoms compared to the control group. So now using these articles to compare to articles that I previously presented on. So the older articles were shorter in duration and were mostly self-reported, meaning that these results could have been skewed, versus the newer articles were more structured, where they were meeting in a clinic and they weren't filling out a survey necessarily and mailing it back in. So this was more structured and kind of verified that these results were probably a little bit more accurate. And in addition, for the older exercise, they only were comparing exercise to medication. They weren't comparing types of exercises, intensities, length, duration, or anything like that, or making any defined lines of what type of exercise that they were looking for. The people were just able to report they did exercise for 30 minutes and if they felt better or not. Whereas this newer articles gave a predefined length, type of exercise, whether they were doing it in a group or at home or any other form of exercise, and then they were able to compare it to a control group that wasn't doing anything, and we were able to see that regardless of the type of exercise, intensity, duration, there was an improvement in the effects of exercising compared to this control group. So overall, the new articles just kind of showed that no matter the types of exercise or intensities, that they were all equally effective compared to the older articles, which didn't have that defined line of what type of exercise that they were looking at. And also the articles were longer, the newer articles were a longer study, longer duration, whereas the older articles were maybe for 4 or 5 weeks. The newer articles were 12 to 16 weeks, so you're able to see the more long-term effect, versus the older articles were looking more at the immediate effect. So for continuing this research, I thought that it would be important to compare exercise to more types of treatments. So there's people who who meditate or go to talk therapy, and then comparing it to antidepressants. So they had this all in the various articles, but it was in addition to medication and talk therapy were combined, or just not doing them individually, where I think it would be effective to compare the types of treatments or exercise treatments to just meditation or just talk therapy or just antidepressants, so you're able to have a better defining line of which one is effective in comparison to this or this or this. And then also I wanted to see if group therapy was more beneficial. So they had clinical exercises where they were in a group, but they didn't really compare the effects of the group exercise versus being at home, which would be interesting to see if the group exercise is more effective than just being at home. And then figuring out what the appropriate duration for exercise to see effects should be. Should they do, what would the more long-term results see if they continued exercising even after the program was over? How many times per week is the most effective, and what is the duration? So 30 minutes a day, 45 minutes a day, what is the most effective time per day and per week that they should be doing exercise. So that is all that I have for you. Thank you for listening.